In this program, I want to share my experience after having worked with the rehabilitation of hands and arms for many years. The purpose of this film is to show the most common causes for and how to avoid getting a tennis elbow.
Tennis elbow is the most used common expression in everyday speech. This, however, does not mean that the ailment mostly is caused by playing tennis, but rather has work-related causes.
In medical terms, this is called lateral epicondylalgia, which means pain at the attachment of the extensor tendons and in the extensor muscles.
To gain power for the rehabilitation of your arm and hand through activity analysis, treatment, new working technique.
The tennis elbow is a frequently occurring condition of pain in the elbow and in the extensor muscles in the forearm.
Tennis elbow seems to be caused by a rupture of the tendon at the attachments in the insert of the extensor muscle and in the muscles. Damage in the muscle attachment due to overusing the muscles usually occurs after the age of 35, when tendons and ligaments tend to become more fragile. The cause is in most cases work-related.
It is difficult to cure a tennis elbow unless you alter the causes of the distress. As a therapist, I assume that the individual has an inherent capacity and willpower to solve problems, given the opportunity and the knowledge.
To be able to give a diagnosis, 2 of the following 3 tests have to be affirmative. You must feel a pain in the epicondyle, that is, in the muscular attachment in the elbow, and also notice a pain in the extensor muscle when overloading the wrist and/or the middle finger.
Before tennis elbow is treated, other illnesses have to be excluded, such as neck problems or nerve entrapment from the forearm. It's very important that you follow the advice given by your occupational therapist or the physiotherapist.
The cause of pains most often are due to excessive movements of the wrist and one-sided strain of the forearm. The reason is mostly work-related and may occur either very sudden after unaccustomed activity with repeated movements, or may come slowly in connection with monotonous movements while working. Perhaps you have been bending and stretching your elbow joint in combination with the wrist movement, as for example when using a hammer, hedge cutting or shaking something. When using a screwdriver, your arm is twisted in a way that could increase your pain. Or sitting in front of the computer with your arms in an overhand grip for a protracted period of time.
The treatment of your arm is important. If you overstrain your arm for a great extent, the best you can do in order to recuperate is to let it rest.
When going to sleep, stabilizing wrist support with a splint will stop you from bending the wrist and also facilitate for the stretching muscles to relax. It is important to keep your elbow in a straight position also during the night, in order to prevent dull pain and difficulties in stretching out the elbow in the morning. Thus, the healing and the blood circulation will increase in the entire arm. When lying down on your right-hand side, you can hold your injured arm in this fashion, and when lying on your left-hand side, a cushion might relieve the pressure on the arm. Sometimes using the wrist support will help to keep the elbow straight, but occasionally it is necessary to use an elbow splint.
You must never lay on your stomach with the arms under your body or under the pillow, since the circulation to the arms then will diminish and accordingly also the capacity of the self-healing.
In order to reduce the pain from the arm, try to put an ice pack on the painful part for 20 minutes. This chilled cushion is made by wristlet weave and is filled with round rice. It emits a pleasant chilliness.
If you feel much pain during the daytime, you may also use the wrist support with splint, or if you know you will be doing something strenuous which might add your problems. If you move your index and middle finger at the same time as you look at the upper part of your forearm, you will see how these muscles are moving, and this is exactly where the cushion should be placed.
The cushion on the inside of the tennis arm protection should exert pressure, thus relieving the pain of the influencing muscles. The epicondylitis support might function as a stop for you when working to prevent maximal strain of the muscles in the extensor muscles and to relieve the muscular insert by diverging the strain.
The epicondylitis support can be used when working and training as long as you are getting better and stronger by using it.
If, on the other hand, you would feel an articulate muscular fatigueness from using it, you must of course remove it.
How much do I move my wrist? In order to make yourself understand how much you move your wrist, it might be good to use a softer wrist protection when working.
A wrist protection will permit only a restricted movement of your wrist and will make you aware of exactly how much you move your wrist when working. Thus you will be able to find a more lenient pattern of movement.
You should also consider how you bend and stretch your elbow and how you twist your forearm in order to find a more lenient pattern or movement.
Many of us are extremely right-handed and don't imagine we can perform much with our left hand. Generally speaking, it is utterly important that you try to use both arms to a greater extent at work rather than just using the dominant hand.
Thus, it is a matter of becoming two-handed in order to avoid overstraining of one arm.
Evidently, the time of exposure for a specific work is also of importance. One suggestion is to use your timer in order to avoid too intense hours of work without a break. In the long run, no human body is able to work as much as 12 to 16 hours in 24 hours.
To a great extent, it is a matter of gaining a better insight in order to participate and to take responsibility for one's own treatment.
The most important message for minimizing the risks for troubles with your arms is variation of your movements and activities, as well as taking regular short breaks. You will benefit from trying to vary between sitting and standing during work.
If you find yourself tensed, upset or impatient, this could in the long run lead to ill health. Take a deep breath. Lower your shoulders and tell yourself to lessen the stress and get a more balanced life. If you feel the last tendency to pain, tiredness and increased muscular tension, the best you can do to prevent relapse is to actively stretch your muscles. If you do this regularly during the day, you won't feel muscular fatigue.
This is how you stretch the extensor muscles.
Relax and lower your shoulders. Move one arm forward, straighten the elbow, bend your wrist down, keep your fingers flexed while pressing with the other hand against the hand. Hold for 30 seconds. You can feel the stretch at the outside of the arm. And now, relax.
This is how you stretch the flexor muscles.
Relax and lower your shoulders. Move one arm forward. Straighten the elbow. Turn your palm towards the ceiling. Bend your wrist down. keep your finger extended while you at the same time press with the other hand against the extended fingers. Hold for 30 seconds. You can feel the stretch in the muscles at the inside of the arm. And now, relax.
Stretching enhances the oxygenation in the blood of the muscles. It decreases the tension and the pain in the muscles and increases the capacity for healing. It will make your arm feel better.
Regular daily eccentric exercise. That is an exercise which is extending and at the same time training the muscles combined with stretching. It's very important to perform in order to recuperate.
The exercise has to be carried through during a 12-week period. However, sometimes you will have to continue for a longer period of time, depending on what kind of work you perform. The cause why you might need such a long period of training is that it takes a long time to build up the tenability in the muscles, tendons and inserts. Sometimes you have to go on with the training during even a longer time, depending on what kind of work you have.
The best result of the treatment seems to be obtained by performing the practice regularly before starting work. This seems to be particularly important to those who have a heavy work situation.
In every situation, warming up is important. Before training the arm muscles, you should give some minutes of lifting and lowering your shoulders. Proceed by writing the whole alphabet in large letters. The purpose of the warming up is to increase the blood circulation in the muscles. Stretching of your extensor and flexor muscles for 30 seconds. Repeat 3 times. The eccentric training starts with rather light weights, like 1 kilo for men and half a kilo for women. The weight increases for every week. An easy way to do this is by using a training tool which can be filled with water. Women start with 5 deciliters and men with 10 deciliters. The amount of water is increased by 1 deciliter per week. The strength training is performed in sitting position. Rest your forearm on the table with your hand outside the edge of the table and with your wrist stretched upwards. Hold the weight in your hand, lower the weight while you slowly count to 10. Take away the weight with your other hand and move the other one back into position. Repeat 15 times. No more, no less. Don't worry if you feel a certain pain during the training. You can ease the pain by using the epicondylitis support. If you feel pain after the training, put something cold on the area for about 20 minutes. Finish the training with the same stretching as you did before the strength training.
To be able to understand how and where the strain begins, I will show you the flexor muscle, which name is biceps, and its attachment at the part of the forearm, which name is radius. That is the red dot on the skeleton arm.
When lifting, you will get your power from the biceps by bending the elbow joint with an underhand grip. You can feel how your biceps tightens.
With your arm in handbreadth position, the biceps still functions sufficiently. You can even feel how biceps tightens.
But what happens to the biceps muscle when the forearm is twisted so that the hand will be in an overhand grip? Well, with your arm in this position, the large biceps muscle will mostly be disconnected and only the forearm muscles will do the lifting. You can feel that your biceps muscle now is not so tight any longer and the red dot of the attachment on the skeleton arm is disappeared.
This is the main cause for the emergence of the tennis elbow, since the strain simply becomes too much for the muscles of your forearm.
Recommendations. The weight of the load at repeated overhand grips must not exceed half a kilo.
The weight at an underhand grip must not exceed 5 kilos.
Though, when it comes to the overhand grip, I know from experience that by too many lifts, even with a lower weight, the tennis elbow syndrome is common.
Now is the time for the double hand.
Lift in a way so it doesn't hurt. Vary the grips frequently if necessary.
Don't overload your bag and lift it with an overhand grip. Turn your arms and take the handles by the breath hand grip when you walk from the car to your house. The best way when pulling a suitcase is keeping the handle in this way.
Try to remember lifting in a manner so that you won't feel any pain, and vary your grip often whenever needed. Avoid bigger milk cartons. They are too heavy and may easily trigger pain.
The 1 liter packages are easier to grip, but even this could be rather difficult. The easiest way is to have a special holder.
A knife with a hand breath grip will help you keeping your wrist straight, compared to an ordinary knife which you need to slant your wrist downwards.
When working with a straight wrist, you will be drawing your strength from the large biceps muscle and will therefore become stronger compared with slanting your wrists, which in this position will be overloaded and might cause pain.
Cutting cheese with a hand breath grip is also easier compared to using an ordinary slicer.
Many of us are peeling potatoes with a regular flexing and stretching of the wrist, simultaneously using the thumb as a resistor, which adds to the stress in the thumb as well as in the wrist.
Take a grip on the potato peeler with all fingers, letting the thumb lay relaxed around the handle and peel away from you with a straight wrist. It is advantageous trying to peel away from you instead of towards you. The least difficult can opener I've found so far is one with the following instruction. Carefully lift the edge of the jar until the vacuum is released and the lid easily removed. This anti-slip opener gives you a better grip when you want to open different tins and jars. This opener is handy when you want to open tin lids with metal rings.
When whipping, I would advise you to use a whip with an enlarged handle, but rather try to whip with your hand in a hand breath grip in order not to strain your arm. An electric lightweight whip will also do. When mopping a floor, it is advisable to use a jointed ergonomic mop with a mobile in-between part on the shaft and stopper placed high up in order to enable the wrists to remain as straight as possible and to hold a loose grip around the shaft to prevent unnecessary tension of the muscles.
Learning the right technique is A&O in order to be comfortable with this cleaning tool. It is up to your health service to teach the techniques.
Wringing a scouring cloth can be painful. Preferably squeeze out the water and use a lightweight cloth.
You can go on working much longer when using a hand breath garden hoe in comparison to an ordinary garden hoe, since in the first case you will be keeping your wrist straight and accordingly be getting your strength from the biceps muscle.
When painting the walls of a house, you should hold the brush in the same way as you hold a pistol in order to keep your wrists straighter compared to using an ordinary brush. If you act in this way, you might avoid triggering a tenniselbow. You should paint with a breath hand grip. This grip can be used to improve many other different grips.
Also, when using a spatula, you should try to fix your wrist in order to avoid too much movement in it. When driving, you might often feel pain by holding the wheel with an overhand grip for too long.
You will benefit from shifting between overhand grip and underhand grip. Your arm might hurt extensively when holding your hand in an overhand grip from above on the gear shift in a car with a manual gearbox. Try instead to use the hand breath grip as much as possible. Certain bike handles will force your wrists into an extended position, which in the long run is not advisable.
A slanted handle will allow you to hold your wrist more straight and will give you a better position for all your body, especially for the neck and back. It isn't always possible to avoid disadvantageous postures in your work. I've already informed you by my general advices. Moreover, I recommend you generally to sway the markets to the greatest extent in order to find the best economically designed tools.
Development progresses rapidly, and you will have to be on the alert to look after your own interest in order to spare your body.
My best advice here is to keep your wrist as straight as possible when typing on the keyboard.
I do recommend a forearm protection in order to relieve the pressure on your forearm. Use as many short commands as possible.
In this wrist support, there is a bar mouse which you can handle with your right or left hand.
Laptops are used more and more, and this computer has a wrist relieving support. Always use the mouse with the left hand to relieve pressure from the dominant hand. It's easier than you think to change from right to left.
I do recommend regular breaks and exercises for your arm and shoulders. Micro breaks when you're just turning up your palms up towards the ceiling will feel good, as well as stretching, as I already taught you.
Another way of stretching, with which I'm sure you will get on well, is stretching all the way from the breast muscles with the forearms and the wrists backwards, the thumbs upwards to the ceiling and the shoulder blades together.
Handwriting may cause problems and increase pain if the pen is too thin. It will be easier with an enlarged pen, which will give you a more relaxed grip.
To exercise at a gym might be good for you. Just remember to hold your wrists straight when working with dumbbells or using various tools for exercise.
When walking your dog, do not hold the leash in overhand grip, but rather use the hand breath grip and bend your elbow. Moreover, the general rules that I've given you earlier will apply. With this pin, I want to convey the most important knowledge concerning what causes and how to prevent getting a tennis elbow.